Hello and welcome to my channel. Today we're going to talk about painful sexual intercourse, a condition that can make our women's sex lives feel bland and unsatisfying. Let's explore together why some women experience pain during their sexual encounters. Can a woman or a man experience pain during sexual intercourse? Yes, they absolutely can. In men, this might manifest as testicular swelling, throbbing, or groin pain. For women, pain can be felt during penile entry or deep penetration, and may also be experienced in the groin, lower back, or vulva. So, let's delve deeper into why women experience painful sexual intercourse. First, we need to determine if the cause of this pain is psychological or organic. In other words, we need to understand if there's an underlying medical reason. For this, it's crucial to consult with a gynecologist who can thoroughly evaluate the situation. If there are other symptoms, these should be investigated, followed by a gynecological examination. This examination typically involves a vaginal and rectal exam, ultrasound evaluation of the uterus and ovaries, and checks for vitamin and hormonal imbalances. What is our goal during examination? Our primary goal is to inquire about other symptoms accompanying the patient's pain. Is there burning during urination, discharge, foul odor, fever, general body weakness, or vitamin and mineral deficiencies? We need to identify these. Is an intrauterine device being used as a birth control method? This can also lead to pain and infection. Is there a suspicion of pregnancy? There could be a miscarriage, ectopic pregnancy, blighted ovum, or a problematic pregnancy that the woman might not be aware of. Does the pain occur in every position? We need to determine if the pain is present in the missionary position, the woman on top position, or another position. How many births has she had? Were there any tears during birth, or an unhealed wound? If she had a C-section, how many times has she given birth? And were there any complications afterward? Are there any prolapses of the bladder or bowel? Is constipation present? We need to seek answers to all these questions. Numerous factors must be evaluated to uncover the cause of painful sexual intercourse. We need to ask our patients many questions and conduct a detailed examination. During the examination, we check for any wounds or discharge in the vagina, and it may be necessary to take cultures and a PAP smear for infection. Are there hemorrhoids or anal fissures? Is there any opening or weakening in the perineal area? On ultrasound, are there ovarian cysts, uterine fibroids, polyps, thickening, or chocolate cysts? The overall structure of the uterus should also be checked for any abnormalities. When evaluating within this framework, we first take a comprehensive history, perform an examination, and conduct hormone tests and an ultrasound. If all these results are clear and normal, we then move on to these questions. Are there muscle contractions during intercourse? Can you focus on sexual intercourse? Are you comfortable during foreplay? Are you adequately lubricated? Can you dedicate enough time to sexuality? What is your communication like with your partner? Our aim here is to understand if there are any aspects of the sexual relationship that are going wrong. Is there a psychological origin? If there's contraction and straining, then we go back to the beginning. Could this be a case of vaginismus? Sexual intercourse occurred, but how? Was it traumatic? Did it happen forcefully? Was there no sexual intercourse at all for the first 2, 3 months, or even a year? Did the couple then try to have intercourse by forcing each other? But did this intercourse not turn into an orgasm experience? Was sexual compatibility never established? Has the woman been experiencing painful intercourse from the very beginning? Yes, this is very important because some cases of vaginismus can be secondary, meaning they can develop after childbirth. A sexual trauma might emerge, for example, if a woman experiences a coercive situation, such as being threatened or sexual abuse, she might start experiencing painful intercourse with contractions, even if she hadn't experienced vaginismus before. We also have a condition called vulvar vestibulitis. Some women experience constant sensitivity at the entrance of the vulva. This condition arises from sensitivity in the branches of the pudendal nerve due to various reasons. The causes of this condition can include chronic infections, recurrent vaginitis, perineal tears or trauma during childbirth, or nerve sensitivity resulting from traffic accidents or falls, just impacts. Additionally, chronic inflammation in that area, cyst formation, or surgical interventions like draining a Bartholin's abscess can also make the vulva sensitive. Another cause of pain is lichen sclerosis in the vulvar region, which can lead to painful sexual intercourse due to inflammation in that area. When taking a history, we particularly ask these questions. Is there contraction from the very beginning? Is there vaginismus? Or was everything fine initially, and then painful intercourse started later? For example, did this condition appear within the last week, a month, or after childbirth? If everything was normal at the beginning and pain started later, we focus on medical reasons. However, if the patient says, "I've been experiencing painful intercourse from the very beginning. I've never been happy. I've always had painful sexual intercourse," then we focus on psychological reasons. Treatment methods will also be directed toward the cause. If the condition is psychologically rooted vaginismus, we address it as a sexual dysfunction problem and restructure the sexual life from scratch. If there is an organic cause, we turn to medical intervention. In the next video, we'll focus more on treatment and provide you with much more detailed information. As we conclude our video, I have a request for you. The algorithm allows this content to reach many more people and makes our efforts visible. If you like, comment, and especially share the video with your friends. Thank you in advance for your contribution. Stay healthy and happy. And I wish you a fulfilling and joyful life in every aspect, including your relationships.